Hello, everyone. Today we will be talking about diabetes. And in essence, we know how diabetes work. Um, we know what comes along with diabetes, but here I've done further research on diabetes. As you can see here with the title, Making the Case, Addressing Comorbid Depression and Diabetes in Primary Care. So on the left here, let's start with the target population. And I'm only going to go over this a few because I do believe that seeing is believing, and I have more of an intriguing um, topic or diagram or program, as you want to say. But here we have target population overview. People living with type 2 diabetes and depression are becoming an increasingly prevalent and unmet medical need in the healthcare system. Primary care clinics in urban communities frequently encounter these patients with a high degree of comorbidity. Straining individuals and families, these conditions challenge healthcare use and therapeutic outcomes. Down to the left side, we have prevalence and significance. A significant study demonstrates the prevalence and significance of this problem. An analysis of 1.1 million patient records showed that depression in patients with type 2 diabetes grew from 22 to 29% in 2006, and even a bigger jump in 2017, with the percent going from 29% to 43%. The study found that the prevalence of depression among multimorbid adults increased, most notably in younger age groups. And this is true because, for me and myself personally, back in my early or early 20s, I was diagnosed with a pre-diabetes. Here at the bottom, you do have figure one here, trends in depression. Sorry about that. Trends in depression prevalence among adults with type 2 diabetes, 2006 to 2017. And here are those percentages that we discussed. Up in the top right hand corner, we have role of primary care providers. Person-centered care services are often the first professionals to recognize warning signs and symptoms of depression among patients with diabetes. Primary care physicians, PCPs, often identify signs of emotional distress or lifestyle lapses as initial healthcare providers for their diabetic patients. Regular contact with diabetic patients equals primary care providers with an ideal chance to identify and tackle depression at the outset of their treatment. By integrating behavioral health professionals into primary care teams, patients can get immediate mental health care and enjoy better overall well-being. Now, people don't see diabetes in the same category as something like HIV or AIDS. When people are sitting in front of a doctor and they get diagnosed with diabetes, it may not be a terminal thing, but it is a life-changing thing that most definitely can affect the mental. And I feel like as a doctor and behavioral health student, we most definitely want to integrate that kind of care in primary care settings to be there for those individuals and not necessarily just say, here's a medication you have to take for the rest of your life, but more or less prescribing a goal for them to reach so they can keep aspiring in life. So I'm going to actually stop sharing my screen here. And I'm going to share another thing because, again, I believe that seeing is believing. And give me 1 second here. Sorry that my screen is paused. So here we have another screen here, right? So feel better every day managing diabetes and depression. So here I made a brochure that says eat well to feel well. Eat 3 meals a day and 1 or 2 snacks each day. Pick whole grains, fruits, veggies, and lean protein. Drink water instead of sugary drinks. Good food equals steady sugar and a better mood. Down to the bottom, you have lower stress, feel more in control. And we have some examples here. Breathe deep in through your nose and out through your mouth. Try writing down your feelings in a journal. Use apps like Calm or Insight Timer. And we have some more suggested here. Down at the bottom, you have take your medicine your way. Because again, this is more person centered. And again, we're here to prescribe those goals. So take your meds at the same time every day. Set phone reminders or use a pill box. Ask your doctor or pharmacist if you're ever unsure. We have more goals there. To the top right, move a little, feel a lot better. Try walking, stretching, or dancing. Start small, just 5 to 10 minutes is okay. And moving your body can lift your mood and lower your sugar. Down, we have sleep equals energy and better blood sugar. Go to bed and wake up at the same time each day. Turn off phones, TV, screens for 30 minutes before sleep, and try a warm shower, soft music, or reading before bed. And good sleep helps with depression and diabetes. And lastly, the most important one, you are not alone. Join support groups to share and learn. Ask questions. Your doctor, nurse, and behavioral health team are here to help you. And talking with others can help you feel better as well. And this is my topic on diabetes. Thank you.